All right, so this is a book that I made for head and neck anatomy that is aimed for MRCS candidates. I've used in this book multiple sources, and this include Netters and also some other books such as Get Through Anatomy and some other common sources that are being used for the MRCS. So I'm going to go through the whole head and neck anatomy today and try to cover as much as I can and very quickly a way with question and answer based way to go through that. So this is my table of content. The book starts this way: table of content, and it has all the structures, all the parts that need to be covered in the head and neck, as you can see here. Starting by skull osteology, you have like many questions, around 17 questions, and then temporomandibular joint is a little bit related to it as well, and then muscles of the temporal region, and then muscle of mastication. You go to the neck muscles as well, and the neck triangles, and after that you go to lymphatic drainage, thyroid, parathyroid, and larynx, and you will notice that all of them are a little bit going in systematic manner and arranged as well. So the parotid gland and submandibular gland and so on. So all of these are the table of content that are needed, and I think if you're not using this book, you can use at least the table of content as an index for you of what you need to cover in the head and neck anatomy. So starting by skull osteology, I'm going to start by the first question, which say the age at which the cranial sutures ossify. So it's usually at 18 months, starting at 18 months and 24 months for the frontal, the anterior fontanelle, all right? So the anterior fontanelle is usually in 24 months and 18 months in the posterior fontanelle as well. The name of the condition where the cranial sutures do not ossify or do not fuse, this is called the craniosynostosis, and obviously this can lead to significant increase of the intracranial pressure and can affect all the brain functions basically. Age the development mastoid bone, and it's 2 years, all right? It's 2 years for age of development. So if you remember, we mentioned 18 months and we mentioned 2 years as well. So 18 months is basically the fontanelles and or the sutures, and 24 is the anterior fontanelle, and also the mastoid process will complete or will reach full development. So diploic veins, so these are veins which drain the bone between the inner and outer cortex, or inner and outer table of the skull. If we take a section of the skull, you will find that there is an outer table and also an inner table as well. So the bone between it will have lots of diploic veins that are being drained into the superior sagittal sinus, which is literally just below the inner table of the skull. The pterion, is normally formed by the frontal bone, and then you have the temporal bone as well coming in here, and you have the sphenoid bone in addition to the parietal bone as well. So parietal, frontal, and temporal, and the sphenoid bone form the pterion. The pterion is quite an important structure which represents multiple clinical approaches for many different surgery, including the aneurysmal surgery, which is called the pterional approach, all right? The pterional approach. And also it's an important structure because the middle meningeal artery passes in the inner side of the pterion. So any injury to the side of the head can lead to an epidural or an extradural hematoma. So these are the clinical significance. If you do a sort of the pterional approach, or any burr hole over the pterion area, it will pass through certain structures, starting by all the scalp layer, But notice that on this side we have the temporalis muscle as well. So instead of loose connective tissue, we're going to replace this by temporalis muscle, and you have a skin, you have connective tissue, you have the aponeurosis, and you have the pericranium, and then between the temporalis muscle and its sheath as well. The source of subdural hematoma usually the source are the bridging veins. So for example, if you have here, if this is the bone, and below the bone or very adherent to the bone, you will have the dura, just very adherent to it. And this is the subdural space. This is obviously the arachnoid matter. You have some bridging veins connecting between the sinus here and down there. So this is a bridging vein. When the brain starts to shrink in size, this bridging vein will stretch and might cause some sort of bleeding in this area, which is called subdural hematoma, or even cerebral veins, which will be found on the wall of the arachnoid mater on this side. So it could be cerebral veins or the bridging veins as well. Stylo process muscles attached to it, so it will all obviously start by stylo, and you have to the pharynx, so stylopharyngeus muscle, and to the tongue, so styloglossus muscle, and to the hyoid bone, stylohyoid muscles. So you have three muscles attached to the styloid process. So identify the following structures. So you have here, this is the lateral X-ray, and you have some sort of openings in these X-rays that a little bit dark means it's containing some air, and we basically name them based on where they are. So you have here, this is the frontal bone, so that is going to be the frontal, and it's a cavity containing air, so that would be frontal sinus, okay? And here, this is the ethmoid bone, see this is the ethmoid sinus, and this is the maxillary bone, so that will be the maxillary sinus as well, okay? And moving to this one, so that will be the sphenoid sinus on the other side, okay? So you have multiple structures in here, and all of them are sinuses because they are cavities containing air. This is maxillary, this is ethmoid, and this is frontal sinus, and finally this is a sphenoid sinus. So we need to identify the following structures and also the structure that go through them. So starting by number 3, this is going to be the carotid canal, and we're going to cover what passes through them now. But mainly what you need to mention in the carotid canal is internal carotid artery. Number 9, on this side, this 9 is basically the foramen lacerum. Foramen lacerum. So this is going to be foramen lacerum. Okay, and foramen lacerum is basically, if it's like a cavity like that, so the inferior part of the foramen lacerum will be obliterated by fibrocartilaginous material, and the superior part will have the internal carotid artery passing just above the foramen, but not actually inside the foramen lacerum. So the internal carotid artery will go from here and then will pass just over the foramen lacerum as well. Okay, so we said foramen lacerum and the carotid artery and the carotid canal. So this is number 3, the carotid canal, and number 9 is foramen lacerum. Obviously, number 10 will be the foramen magnum, which is the biggest one, and foramen magnum is where the medulla ends. So basically, you will have here the medulla will end, and the spinal cord will start. Okay, you have some arteries. You have the vertebral artery will enter through this foramen, and you have the spinal artery, which is the branch of actually the vertebral artery, will go down to supply the spinal cord as well. And you have the apical ligament of the odontoid peg, and this will be covered in the spine part as well. Okay. Here on the side of the foramen magnum, you have a small canal on this side, a small canal. So this canal is called the hypoglossal canal, and from its name, it contains the hypoglossal nerve. Okay, so this is the hypoglossal canal, which contains the hypoglossal nerve. What about number 20? Just lateral to the canal. So obviously the canal is from here and coming out from here as well. And on this side, just lateral to the canal, you have a big, quite big foramen just behind the carotid canal as well. That's called internal jugular. Continue the internal jugular vein. So this is jugular foramen. Okay, that's jugular foramen as well. And obviously the jugular foramen will contain internal jugular vein and the nerve 9th, 10th, 11th nerve, and the petrosal sinus as well, or the sigmoid sinus as well, will continue at internal jugular vein. Okay, so these are the structures on this side. I'm not sure if there's anything else to cover. Maybe number 11, and this is foramen ovale, and we'll comment to that as well. Maybe number 12 is foramen spinosum, foramen spinosum as well. So these are the foramens from the inferior surface of the skull. Magnum is quite evident, and just beside it is hypoglossal canal. Just lateral to hypoglossal canal is the jugular foramen, and just anterior to them is the carotid canal. a big one, which is irregular in shape, number 9. This is the um, foramen lacerum, and an oval foramen, so foramen ovale, small foramen beside it, this is foramen spinosum. The structures passing through it, we'll come into it now. So starting by carotid canal, that was number 3, and it contains mainly what you need to mention is the internal carotid artery, but otherwise, I'd be very happy to cover the others as well. But to be honest, what I prefer remembering is the internal carotid artery. 2, you have foramen lacerum, and we said it's 2 parts. You have a cartilaginous part, which is obliterated, and the other part which contains the carotid artery, internal carotid artery. You have foramen magnum as well, and we mentioned you have the medulla oblongata will end, and the spinal cord will begin, and this reminds you by spinal arteries, and this reminds you by vertebral artery, and A reminds you with apical ligament, which is attached to the odontoid peg as well. You have hypoglossal canal, we mentioned it number 15. Remember that canal from foramen magnum, small canal in here, the end right there, which contains hypoglossal nerve. Remember, jugular foramen as well. And jugular foramen, it contains the internal jugular vein. What form that is the sigmoid sinus, and then 9, 10, 11 nerves, okay? Great. Maybe we didn't mention 47, this one, the stylomastoid foramen. So obviously you have here the 26 is mastoid process, and just anterior to it is the stylomastoid foramen, and this contains the stylomastoid artery, and the facial nerve leaves the cranial cavity through that foramen, stylomastoid foramen. Okay, so we're going to now cover the same foramina, but from the inside rather than from the outside. So this now you're currently inside the cranial cavity. Number 11, again, that will be the foramen magnum, and we mentioned what is contained in it. You have the medulla oblongata, spinal cord, spinal artery, vertebral artery, and apical ligament. 27, remember that is small canal, which opens on the outer side. So 27 will be the hypoglossal canal, and the hypoglossal canal contains hypoglossal nerve, okay? Hypoglossal canal contains hypoglossal nerve. All right, so number 30, if you remember, just lateral to the canal, but from the other side, that will be the jugular foramen, okay? Jugular foramen. Great. Looking a little bit closer, you know, this is an oval structure on this side, small structure beside it as well. So number 12 on the other side will be the foramen ovale, and 14 will be foramen spinosum, okay? And I'm going to mention the structures in a bit. It's quite easy to remember the ovale one, which goes with the name as well. O is otic ganglion, and V3, and ascendomeningeal. We're going to come to that as well in a minute. Spinosum usually contains middle meningeal artery. Okay, there is another foramen here just below the clinoid process, which is called the foramen rotundum. Foramen rotundum. Okay, this is foramen rotundum as well. Obviously, one is the anterior clinoid process. Okay, and you have 34 is the optic canal, and from the name, it contains the optic nerve. 4 is something called the clivus, it's just the bone. And here, this area, so let me just highlight it to you, and then I'm going to delete that. So this area, we're talking about the cellar area, or the cellar tersical, where the pituitary lies, okay? So 38 is the cellar tersica. This is the cellar tersica. Okay, and you have number 8 and number 40 as well. So 40 is something anterior to it, and 8 is posterior to it. So 8 is going to be the dorsum cellar, and 40 is the tuberculum. It looks like a tubercle, so it's called tuberculum cellar as well. Okay, so you have cellar tersica and tuberculum cellar just anterior to it. 42, which is a little bit subtle, it's a canal, but it's actually a fissure, canal to be sort of like that. This is just a 2D image trying to show a 3D structure, so it's quite difficult to do that, but that will be the superior orbital fissure, okay? It contains loads of structures that we're coming we're going to mention as well, okay? So I think, yeah, that's a good coverage to most of what need to be covered in this picture. So obviously here you have the internal occipital protuberance, number 29. On both sides you have the transverse sinus will be lying on the 23rd. Okay. Yeah. So maybe we can say 43 is something called the tegmen tympani. Tegmen tympani, and it's an important structure as well because this is where the infection from the middle ear, which lies just below it, can spread to the brain. 41, this is the temporal bone. This one is the temporal bone, so that's called the squamous part of temporal bone. 37, this is the petrous, so that's the petrous part of temporal bone, and this is obviously the superior border of petrous part of temporal bone, and this looks like an impression in here, so that's an impression for superior petrosal sinus. I know it's quite tricky to try to remember this one, but with practice, you'll be able to remember all of them. So we mentioned anterior clavicular process, number 1, remember that. We mentioned the clivus, we mentioned dorsum cella, and petrous part of temporal bone, and squamous part of temporal bone, and tegmen tympani of 43. Here, we mentioned foramen magnum and the contents of it, and we said it multiple times. Oval, we mentioned oval, it comes with the word oval as well. So O is for otic ganglion. V3, okay, so V3, it means, reminds you of cranial nerve number 5 and the third branch. So that would be the mandibular branch of trigeminal nerve. A is called accessory meningeal artery, accessory meningeal artery, and you have L is lesser petrosal nerve, and also emissary vein. So usually you confuse them, so you have an artery, nerve, and vein. So one structure of each, and it goes like A and V. Okay. Rotundum, and we mentioned rotundum, number 13, if you remember that, and that contains maxillary nerve, or now we're talking about V2, that's V2, or maxillary nerve, okay? And so remember, V3 was oval, and V2 is rotundum. Spinosum, that contains middle meningeal artery, we mentioned it. Hypoglossal canal contains hypoglossal nerve. Jugular foramen, 9, 10, 11, and inferior petrosal sinus or sigmoid sinus with internal jugular vein as a continuation to it as well. Optic canal, we mentioned, contains optic nerve. Superior orbital fissure, the very subtle structure, the 2D structure in a 3D image. So that contains loads of nerves. So try to remember it like that. You have the third and the fourth and the sixth nerve. Okay. And you have some other branches from the ophthalmic nerve. Okay, the ophthalmic, which is V1. So now we get to V1. So ophthalmic will give 3 branches like nasociliary branch and frontal branch and also lacrimal branch as well. Okay, so these are the structures that pass in here. And finally, you have the superior ophthalmic vein as well, can pass through the superior orbital fissure. So lots of 7 structures that pass in here, and we need to cover all of them. Okay. So now we're moving into cranial fossae or the cranial fossa. So we have the cranial cavity. If you look at this image, so the cranial cavity will have 3 different fossa. So you have a frontal fossa or anterior cranial fossa, and you have a middle cranial fossa in here, and you have a posterior cranial fossa in there. So we just need to cover the boundaries of each fossa. So it will be easy if you try to remember all the structures or the front or the bones that are forming the skull, which we have around 8 bones. Okay, so starting by the anterior cranial fossa, we just need to say what is the anterior boundary, what is the lateral boundary, what is the posterior boundary, and what is the floor is formed of. Okay, so anterior boundary of the frontal or the anterior cranial fossa, it's formed of the frontal bone, as you can see in here. So this is the frontal bone. Okay, and posterior you have the greater wing sphenoid. This is posterolateral. this one, greater wing of sphenoid. And posteromedial, you have the anterior clonal process and the tuberculum sella, on this side. And the floor is formed by the frontal bone and also part of the sphenoid bone as well, or ethmoid bone. So frontal and ethmoid and the sphenoid bone. And this contains the frontal lobe of the brain. Okay. The middle cranial fossa, which would be the next part as you look in here. So the middle cranial fossa, again, we need to say the boundaries. So you have one anterior, and anterior would be anterolateral and anteromedial. Remember, anterolateral will be basically the posterior boundary of the anterior cranial fossa. So anterolateral will be greater wing sphenoid, this one, okay? Anteromedial will be the clinoid process, the anterior clinoid process, and the tuberculum sella, okay? So anterior clinoid process or the tuberculum sella of the limbus, okay? And posterior, you have posteromedial and posterolateral. So posterolateral will be this part. So this is the petrous part of temporal bone. And obviously this is the superior part of the petrous part of the temporal bone. And here you have this one, which is the dorsum sylvi, okay? Lateral, you have the squamous part of temporal bone, and the floor is formed by the greater wing of the sphenoid, as you see here. This is the greater wing sphenoid, and that's the petrous part of temporal bone, which is all this area, and again, part of the squamous part of temporal bone as well. It contains the pituitary gland in this area, and on the other side, it contains the temporal lobes of the brain on both sides. Okay, so you see here, this is the middle cranial fossa, and that small, nice image as well. Okay, middle cranial fossa. So the last one in the cranial fossae, so we have the posterior cranial fossa. So again, we need to say the boundaries. So you have anterolateral and anteromedial. Again, it will be the same structures of the posterior border of the middle cranial fossa. So you have anteromedial will be the dorsum sylvi. Anterolateral will be this part, which is the superior part of petrous part of temporal bone. And posterior, you have the occipital bone and the floor. Let's look at that. So we said anterolateral and we said anteromedial, and we said posterior will be the occipital bone all the way through. And the floor, it contains from here, starting by the mastoid bone, okay, all this area. And you have three parts of the occipital bone, something called the squamous part of the occipital bone, and condyloid part of the squamous bone, and basilar part of the occipital bone. So you have a squamous part of occipital bone, condyloid part of occipital bone, and basilar part of occipital bone as well. And you have part of the petrous part of temporal bone as well. Okay, so we'll see on this side, this is the posterior cranial fossa. It contains lots of structures in here. So it contains basically the brainstem and cerebellum, and obviously the cerebellopontine angle will be there as well. Okay, remember we mentioned something called the clivus, which is here, it's this area. And in the very first image that we explained, that was the clivus, if you remember that part. So that was the clivus, number 4. So the clivus is an important structure because there is one of the longest nerves, and the cranial nerves is compressed against that, and it's called the abducens nerve. The 6th cranial nerve is usually compressed against the clivus. That's why with increased intracranial pressure, this nerve will be usually paralyzed with increased intracranial pressure. Okay? Well, the juvenile structures forming it is something called saphenoccipital synchondrosis. And synchondrosis is a cartilaginous union between the bone composed of entirely hyaline cartilage. Okay. Type of growth plate, it's a hyaline cartilage. And time of fusion, to remember these numbers 12, 13, 14, 15, 17, 18. So it's passing girls at the age of 12, 13 years, and boys by the age of 14 and 15, and complete by 17, 18. So basically, what are we trying to say here? That this is actually a cartilage, the clivus cartilage, or in other words, it's called hyaline cartilage, that fuses together to form a bone by the age of 12, 13, 14, 15, 17, 18, and for completion on both sexes. Okay. The benign tumor of the posterior cranial fossa, you will have the ependymoma, and acoustic neuroma. So obviously these are the tumors of the posterior cranial fossa, or acoustic neuroma specifically for cerebellopontine angle tumors, which are the commonest one. Okay, so this is, we're trying to say here, this is a fracture that's going all the way through the skull, and it's called posterior, because one, it's posterior, and it's transverse over the skull, and it's a base of a skull fracture, and it's passing through the sphenoid, so it's called transsphenoid basilar skull fracture. So it starts from here, which is the tympanic and petrous part of temporal bone, passes posterior wall of the sphenoid sinus, and then again to the petrous part, and will end in one of two things, whether it's tympanic or squamous part of temporal bone. Okay, what are the causes of lytic skull lesion? Lytic skull lesion causes can be one, bone metastasis, Paget's disease, osteomyelitis, multiple myeloma, and sarcoidosis and hemangioma. There is something called the sclerotic lesion. So lytic is basically you have activity of the osteoclast, and sclerotic you have activity of the osteoblast that is related to prostate cancer, and this one is most of the other cancer, whether bone metastasis from renal, lung, thyroid, breast, and multiple myeloma, osteomyelitis, Paget's disease, sarcoidosis, and so on. Okay. Finally, in the osteology part, we're going to cover the temporomandibular joint. It's quite tricky to try to remember these structures, but we have a very nice diagram from Netters that will help you remember these structures. So, yeah, it's this one. It's quite nice. So if you look at this area, so you have here, obviously this is the mandible, as you can see here. So that is the mandible, okay? And this is the head of the mandible. So that's the first structure, is the head of the mandible, okay? The second structure will be the mandibular fossa, as you see here. So this is the mandibular fossa. In between, you have two things. You have something called articular disc and articular tubercle. Articular disc and articular tubercle. So these are the four structures that form the mandibular joint. You have lots of capsules and so on, but this is what you need to remember. So obviously here you have a joint capsule on this side. You have a joint capsule, which is this one, as you can see here. And also you have this part, which is the lateral ligament of temporomandibular joint, which is this area as well. Okay, but the structures: head of the mandible, mandibular fossa, and also you have articular disc and articular tubercle, and it's called a hinge joint. A hinge joint, so it's a sort of synovial joint as well. Okay, so these are all the osteology for the skull and temporomandibular joint. Finally, we're going to cover the movements of this mandible. So it can be elevation or closure, and depression or opening, protrusion or protraction, or protraction or retraction, or going a little bit backward, and side to side movement. And here are the muscles that are forming it. But we're going to go through most of these muscles and their basic functions as well. All right. So thank you very much.